Hello, my name is Jonathan Milton. I'm an orthopaedic SHO from the Royal Cornwall Hospital, and I'm going to be presenting a case series highlighting our institution's management of Vancouver B1 and B2 fractures and comparing the outcomes of ORIF and revision surgery. Periprosthetic hip fractures are a common injury and were listed as the third most common indication for revision hip arthroplasty in the 2021 NJR, with a significant associated morbidity and mortality. The focus of this study was Vancouver B1 and B2 fractures. B fractures are those which occur around the stem, with B1 fractures having a well-fixed prosthesis and B2 fractures being those with a loose prosthesis and good bone stock. B1 fractures are traditionally managed with ORIF alone, whereas B2 fractures are traditionally managed with revision of the stem with or without ORIF. Recent studies have demonstrated satisfactory outcomes can be achieved when deviating from this classic management algorithm, for example, performing ORIF alone in the management of B2 fractures. Therefore, our study aimed to assess outcomes after non-contact bridging plate fixation of Vancouver B1 and B2 fractures. Therefore, our main outcome measure was re-revision. Secondary outcome measures were long-term pain, 30-day, and 1-year mortality. We compiled a retrospective case series spanning 5 years. Our starting point was January 2016 to allow for the learning curve in using NCB plates, which started being used in our institution around the 2010 mark. Our inclusion criteria are also listed. We searched our electronic patient record BlueSpear to screen for suitable patients. We then reviewed their notes and assessed for suitability for inclusion in the study. Demographics and outcomes were then gathered from BlueSpear, Maxims, and Insight systems. Our review of operative records illustrated a variety of surgical techniques used in the management of periprosthetic fractures. For uncemented stems, the mainstay of treatment was either ORIF in isolation or ORIF with a revision to a cemented prosthesis. For cemented stems, there was a slightly larger variety of techniques, ORIF in isolation, or ORIF with revision, which could then be subdivided into tap-in, tap-out, tap-in of the same prosthesis, in-cement revision with a new prosthesis, or a complete revision of stem and cement. Our initial search highlighted 479 patients, of which 114 were found to be eligible on further screening. The majority of our cases were fractures around cemented stems, and we saw marginally more B2 than B1 fractures. Our initial stats showed no statistical difference between gender or laterality, and age had a range between 34 and 100, with a mean age of 80. The majority of our fractures were in patients with cemented total hips, but a proportion were in uncemented and hemiarthroplasty prostheses, as demonstrated here. This slide demonstrates the number of patients that underwent each operative technique and is made up of both B1 and B2 fractures. These tables show the distribution of operative techniques used based upon fracture pattern, with total number and then B2 alone in brackets. We've included tap-out and tap-in and plate under the ORIF category, as this technique involved no exchange of prostheses. Therefore, focusing on the contentious area of B2 fractures, 26 were managed with ORIF and revision, and 39 with ORIF alone. As expected from the currently available literature, our management of B1 fractures is unanimously ORIF alone. The single case in which a cemented stem revision was performed was a patient who had pre-existing significant wear of the prosthesis. The management of B2 fractures was predominantly ORIF alone, making up 59% of our cases, but as you can see, there's a far greater variety of practice for these fractures. In our patients managed with ORIF alone, there were no cases of non-union and no plate fractures. Our only case of revision at 1 year were for infections, and this occurred in 2 patients. Furthermore, when looking at secondary outcomes, only 5 of our patients suffered pain at 1 year. Interestingly, 80% of these patients had trochanteric extension plates. When comparing our results to the currently available literature, we're the largest study of Vancouver B2 ORIFs, and we've shown promising results. Despite being the largest sample size, we appreciate our study is underpowered. We've shown comparable mortality and excellent mechanical success. In the future, we'd like to increase the power of the study by either performing a national study or a randomised controlled trial of ORIF versus revision. Thank you very much.